First up, we have Charlotte, and it's some ridiculous time in the morning, Charlotte. Thank you so much for being so game to talk to us at this time. Charlotte is going to talk about lessons learned in the UK, and we of course heard from Vidar in the back about the Norwegian system, but today we're going to hear about the UK. And this presentation is going to cover the UK HREC model with insights into what works and why. So Charlotte, without further ado, over to you to tell us about the lessons learned in the UK. The only way is ethics.
Hi, Gordon. Thank you very much for the introduction. And can I just check you can hear me? Okay?
Perfect, Charlotte. Very
Brilliant.
good.
Oh, thank you. Very relieved. Oh, well, thank you very much, everyone, for the invitation to speak at your conference. It's really exciting to be hearing about the work of ethics committees and ethics review in Australia. It is 4 a.m. in the morning here, so I feel like I should apologise in advance for any slurred words that come out. But without further ado, I will just share my screen.
Yeah, that's all good, Charlotte. We can see that.
And you can see that. Okay, fabulous. Thank you very much. Yeah, so as Gordon mentioned, I'm going to be speaking about some of the work that we've done to make changes and service improvements in the UK ethics service. So in terms of what I'm going to be covering, so in this session, I'm going to be talking a little bit about the structure and remit of the UK ethics service and role of the Health Research Authority in England, REC membership, so who our ethics committee members are, what we ask them to do in terms of the ethics review and how that works, and also our process for ethics review in the UK. So how does it feel for a researcher? What do we ask them to submit? How does the ethics review work? And what do they do once they've got their favourable ethics opinion? I'm going to talk a little bit about our quality assurance processes. So thinking about what Gordon just said about achieving excellence, talking through some of the things that we've done, I guess to centralise and to monitor the performance of our ethics committees and to set specific standards for the committees to work to. And also, hopefully, if there is time, I'm going to speak about some of the challenges for ethics review in the UK, some of the issues that we're grappling with at the moment, and our plans for the future within the Health Research Authority. So just to give you an introduction, we have 64 ethics committees in England, 88 across the UK, including Scotland, Wales and Northern Ireland. That has been very much streamlined over the years. Going back 20 years or so ago, we had hundreds of ethics committees. Every different hospital trust had their own ethics committees, and researchers used to have a very difficult time phoning each ethics committee, working out who the secretary was for that committee, finding out what application form they needed to submit. And if they had 50 different hospitals participating in their trial, they'd have to do that 50 different times. So we've come a long way since there. In the UK, and we now have a very centralised ethics service, just the 64 ethics committees in England, and actually regardless of the number of hospitals taking part in the research, researchers only to submit a single application once, and that ethics opinion applies for the whole of the UK. So the RECs in England are overseen by the Health Research Authority. So the Health Research Authority, who I'm employed by, was really set up due to the really good improvements we had made about streamlining the ethics service in England. So the Health Research Authority was given very specific remit in legislation, which was to reduce duplication and to streamline the regulatory review of health and social care research. And the Health Research Authority is responsible for overseeing the ethics committees in England. We have UK-wide standard operating procedures. So we have a published document of our operating procedures for how ethics committees function in the UK. Those are available on the Health Research Authority website, so researchers can go in, look at them, and it gives them a clear indication of what will happen in terms of the ethics review. And we have the governance arrangements for research ethics committees as well, which very clearly sets out the remit of what types of research need to be submitted to a Health Research Authority ethics committee, and also gives very clear guidance as to what the membership of those committees should consist of. We have an online ethics committee booking system for applicants. So this is something we've introduced in the last few years. It used to be a telephone service. It's now a lot better because we have an online booking service where once applicants are ready to submit for ethics review, they can log into the system, enter some details about the type of research they are doing so that they are allocated to an ethics committee which is suitable to review their application, and they're then given all the options of ethics committee meetings available, and then they can either choose to go to an ethics committee they've been to before. We have some applicants who like to go to the same ethics committee each time, or if they just want to get the opinion as quick as possible, they can select the earliest available meeting date through the system. And flagged recs I've mentioned just because I thought it would be useful to highlight that our ethics committees review a really wide range of health and social care research projects, which I'll talk through in a little bit more detail. But we have recs which are flagged to review certain types of research. So we have recs that specialise in research involving children. We have recs that specialise in the review of clinical trials, medical devices, and research involving adults lacking capacity to consent for themselves. So we have specialised recs flagged for those specific research areas as well. So in terms of what the membership of our recs looks like, go back to that one. So all of our ethics committee members are volunteers. Apart from the chair, so there is a chair of each ethics committee. We have 64 chairs in England. They receive an annual allowance for the extra work and responsibility they do in terms of chairing the committee. But otherwise, all of our ethics committee members are volunteers. And each of our committees is comprised of a mixture of what we call expert members, who are essentially the clinical members of the committee. So doctors, dentists, nurses, and so on, and also lay members, so non-clinical members who come from a real wide variety of different backgrounds. And we have a quite clear definition in terms of how those committees, how that ratio of expert and lay should work. So at least a third of the committee members should be lay. And half of all of the lay members should come from a background which is totally unrelated to research. So some of our lay members are work in things like research governance, research and development offices. So they work within the field of research, but they're not actually clinicians. Whereas we need to make sure that half of all the lay members come from backgrounds which are completely outside of research. So we have such a wide range: lawyers, teachers, hospital chaplains, and so on. We've got approximately 800 members in England. So each ethics committee, we aim to have about 15 committee members who are appointed for 5 years once they are appointed, and if they wish to, they can then be reappointed for a further period of 5 years. We are finding it more challenging to recruit new members. We've definitely noticed since the onset of the COVID-19 pandemic and the pressures in the National Health Service in the UK, we're finding it more difficult to be able to recruit new expert members. So that's something that we're really working on at the moment in terms of what can we do to attract new expert members and to make it easier for them to become involved in ethics committee work. And we have an induction and mentoring scheme for new members. So every new member, when they join the ethics service, we run a national induction programme. So members from all different committees come together, learn about how ethics committees work, what we expect them to do as an ethics committee member. And they also have separate mentoring sessions in smaller groups of new members as well, which has been really well received. That's something we've rolled out in the last 12 months. So what types of studies require review by an NHS Ethics Committee? Well, this slide is really to reflect that our Ethics Committee see a really broad range of research. So in terms of our remit, any research involving participants who are identified from their use of the National Health Service would require an Ethics Committee review. Any research involving participants who lack or who may lose during the research capacity to give informed consent. The processing of patient information, any identifiable patient information, those types of projects would need to come to us. The collection of tissue samples from NHS patients. We also, it's not just for the National Health Service, we also review any healthy volunteer studies, so new drug trials, where drugs are being tested in man for the first time. We review and give an ethics opinion on those types of research projects, and also certain types of social care research, so research which is actually taking place in nursing homes and care homes rather than in hospitals. So our committees review a really wide range of research. And in terms of the numbers that we're looking at, so here is the last 12 month, our last 12-month annual reporting period. I've broken it down into full applications and proportionate review applications, and that's because we have two types of ethics review in the UK. Full applications are the higher risk applications. So it would be things like clinical trials, research involving adults lacking capacity to consent. Proportionate review applications are our lower risk studies, and they go through a slightly different review process. Rather than being reviewed by the full committee at a formal meeting, they're instead reviewed by 3 members of the committee via email correspondence. So the types of studies that would be suitable for our proportionate review processes are mainly questionnaire research, interview studies, studies using data or tissue which has already been collected. So applications where we would expect to see fewer material ethical issues. That's a really popular service with the researchers because they get an opinion nice and quickly. You can see that for full applications, the median review time is 31 days. For proportionate review applications, it's 18 days. And so it's a lot quicker. So it's been a really beneficial service for researchers, which we've rolled out. And then substantial amendments, you see in the purple circle there, we receive a lot of substantial amendments. So these are changes that the researchers wish to make after they've received an ethics opinion. Any significant changes need to go back to a subcommittee, so 2 of the ethics committee members, for review and approval, and we get a lot of those through as well. In terms of how the ethics review process works, I've put together a little flow diagram just to illustrate the process. So the researcher submits their application. It's a standard application form online, so the same application regardless of which ethics committee they're applying to. They'll complete the application form online, and then once they've got all their supporting documents ready to submit, they can then submit all of their documents electronically through our online booking system. So the supporting documents are all the documents associated with the study, so the research protocol, CVs for the chief investigator and the other members of the research team, participant information sheets, the consent forms, any advertisements being used to advertise the study, and so on. There's also, each committee is supported by Health Research Authority staff. So each committee will have an approval specialist, which is the job title of the HRA staff members who support the committees. They will do a validation check before the application is sent to the committee members for review. So they will check the application for completeness. They will check that we've got all the documents we need to make sure that it really is ready for review before it's then made available to the committee members, which is the next step. So all of our ethics committee members have access to an online review portal, which they then access to review and have access to all of the applications which are need to be given an ethics opinion. So those are made available to the Ethics Committee at least 10 working days ahead of the Ethics Committee meeting date, so that the members have time to review all the documents before the Ethics Committee meeting. The meeting then takes place, and we've moved, all of the Ethics Committee members used to meet face-to-face in different venues spread across the country. Since the pandemic, all of the Ethics Committee meetings are now held virtually by Zoom. Each meeting has a meeting chair. So the chair will ensure that each application is reviewed within the dedicated time frame. And we allocate a member of the Ethics Committee to be a lead reviewer for the application. So although we expect all of the Ethics Committee members to have read the applications on the agenda, we'll allocate a lead reviewer and a second reviewer who are asked to look at the applications in specific detail and to kickstart the ethics review. So what happens at the committee meeting is that the members will discuss the application. So it will start with the lead reviewer and then the second reviewer, and then all of the other Ethics Committee members there will be invited to then highlight anything that they wish to bring forward. And as we now have our online portal, which the members use to access the documents, within that they can also add comments next to each application. So that's a good way of giving the chair and the lead reviewer an indication of what types of ethical issues the committee have identified before the meeting itself as well. And then the researchers, the chief investigator for each application is invited to attend the meeting. So at that point, the chair of the committee or the lead reviewer will ask the researcher all of the questions that the Ethics Committee have identified that they need answers to. And that's a really effective way of the committee obtaining clarification of anything that they were concerned about in the application. And often, a lot of the time, with the researcher attending the meeting, those issues can be addressed in discussion because sometimes it just hasn't been written very clearly. So we do find that where researchers do attend the meeting, and most of them do, it often really makes it a lot quicker for them because there's fewer requests for information to respond to in writing after the meeting. And I've listed at the end here the different decisions which can then be given. So the researcher then leaves the meeting, the committee reflect on the answers given and issue an ethics opinion. And they have these options available, either an outright favourable opinion, there's no changes to be made, the research can just start in its current form, a favourable opinion with conditions, so generally a favourable opinion, but there's some very specific changes that need to be made, but those changes don't need to be viewed or reviewed by the committee. The researchers can just go ahead and make them and then start. Or a provisional opinion, and it's still 75% of the applications reviewed receive a provisional opinion at the time of the first review. And that means that the committee is generally happy with the research, but there's a number of changes that they would like to be made to the study documents, or some written clarification that they require before they can issue a final opinion. Or there's an unfavourable opinion. So very low, about 4 to 5% of applications receive an unfavourable opinion. That's when the committee have identified there's some significant ethical issues, and then they're not able to approve the application in its current form. And each of our committee members use an ethics review form to review each application against a series of ethical domains. So there's 9 ethical domains which are listed on this slide here. And I won't go through all of them, but these ethical domains are based on some published ethical requirements which were developed to use for evaluating the ethics of research studies. And I can provide the reference to you after this as well. And what it means is that each application submitted to an ethics committee in the UK is reviewed against these domain headings. So the committee use a lead reviewer form which sets out these domains and what they should consider within each one. for each application. So that has been a real advantage for us. At first, this was very unpopular. The committees used to have their own separate individual ethics review forms for each committee, and they didn't want to move to a centralised system. But now the use of these domains has been really popular, as when committee members attend members of different meetings of different committees, they find that the other committees work in the same way, so they're very familiar with the structure of how the review should take place. And it really helps new ethics committee members as well gain an understanding of what we ask to be considered as part of the review. And this ethics review form is available in the member portal, which the members use, so they can enter their comments against the application within each separate heading of the form. So as well as providing the committees with an ethics review form to help ensure that each application is reviewed consistently, we also have members of Health Research Authority staff who attend the ethics committee meetings and support the committees before and after the meetings with any questions they have. So we have an approvals administrator at the meeting to take the minutes and record the discussion, and we have an approvals specialist who is there to advise the committee on any legal and governance issues, so that the ethics committee members can focus on just the ethics. We found that previously, often ethics committee members would feel pressured to have a good legal understanding of legislation such as the Human Tissue Act or Mental Capacity Act, whereas we now have specialist members of staff attend those meetings to advise on any governance issues or legal matters, and the ethics committee members can just focus on the ethical debate. We also have a designated REC member support team as well, who ensure that the members are recruited efficiently and help them with any training needs and help them with any questions they have about their role on the committee. So in terms of what has been working well in the UK, we've now got, as I mentioned, the HRA assessment, which is the assessment of any legal or governance issues which the approval specialist undertakes, and the ethics committee review happening in parallel. Those processes used to happen separately, which is why often a lot of the ethics committee meeting would be about governance matters. We've now got a way of doing that in parallel, which is working really well. As I mentioned, our proportionate review service for lower risk applications that has been really, really popular. We've got, well, COVID-19 and presented us with huge challenges. We had really urgent public health studies which needed to be reviewed and given an ethics opinion in 24 hours. And our ethics committee members really stepped up to the plate and came forward because they made themselves available at short notice, and we were able to issue favourable opinions for COVID-19 research within 24 hours. But as a result of that, we were then asked, well, why can't we do this more often? Which leads me on to my next bullet point, which is our fast track ethics review. So for early phase clinical trials and global clinical trials, to ensure the UK remains as competitive as possible since leaving the EU, we now have a fast track ethics review for those types of studies. So we'll receive them up to 7 days before the meeting date. So not quite as quick as 24 to 48 hours, but we've continued offering a fast track review for those types of studies. Virtual ethics committee meetings, as I mentioned, the committees used to meet face to face. They now meet virtually via video conference, which has had huge benefits in helping us recruit new members, because previously we'd have to recruit by geographical region. Now it doesn't matter where someone lives in the country, they can join any of the ethics committee meetings. It has been difficult. Some ethics committee members have found it harder to review applications and to engage in the ethics debate whilst meeting by Zoom. But we're continuing to offer opportunities for them to meet face to face, to do things like training days and development sessions. And for researchers attending the meetings to answer questions from the committee, virtual meetings has been brilliant because it saved them having to take time out of their working day to attend the ethics committee meeting. And we also have our combined review process for clinical trials, where we work with a separate organisation which you might have heard of, the MHRA, which is the Medicines and Healthcare Products Regulatory Agency. They review the safety of clinical trials, and that review of the safety by the MHRA and the ethics review used to happen again separately. We've now joined that up for clinical trials, so it's a much more streamlined process, and that again is to help ensure that the UK continues to remain a competitive place to do clinical trials. So I'll just go on to speak a little about our audit and quality assurance processes. So we have an audit programme where every ethics committee goes through a formal audit check every 2 years on a rolling programme, and looking at standards that we've set. But all of those standards are very much based on processes as opposed to reviewing the ethics decision making as such. So we will look at the timelines to make sure that applications and amendments are being reviewed within the expected timeframes. And the audit will also include a review of the membership. So making sure, for example, that each committee has the correct ratio of expert and lay members, that the ethics committee members have been appointed properly, that they've completed the relevant training, and so on. These are the sort of findings that come up from our audits, and I won't go through all of them, but you will see things like we've got low meeting attendance, incorrect use of, and that's attendance by the ethics committee members, as we ask for them to attend at least 6 committee meetings a year. Incorrect use of meeting decisions. So if, for example, a favourable opinion was issued, but there are actually a number of changes requested, it should have been a provisional opinion. Inquorate meetings, that's where we need 7 members present at each committee meeting for the review to take place. So where that doesn't happen, we sometimes have inquorate meetings, which can sometimes be identified through our audit process. So what we do with those action plans is we correct the relevant findings, and we put measures in place as an operational team to look at how we can improve our processes to stop them reoccurring next time. And we have user satisfaction as well. So every researcher who attends an ethics committee meeting is asked to invited to complete a questionnaire on how they found the experience. And most of I should stress, the large majority of the comments that come back are positive. I focused on the negative ones on this slide just to show you what sort of improvements that we're working on. So the main negative themes that come through tend to be a perception that the REC lacked the relevant expertise in a particular type of study. That often happens with qualitative research. I find we get quite a bit of feedback from qualitative researchers saying they don't think the committee had the expertise to understand their methodology. Comments that the questions raised in the decision letter were things that hadn't been discussed at the meeting with the researcher. A perception that the ethics committee didn't focus on the ethical review and raised other types of areas about the research. Delays in the meeting. Comments about the attitude of the ethics committee members sometimes, and a lack of consistency between ethics committee members is one that comes up a lot. It's a real challenge because consistency in ethics is a hard concept to achieve, as ethics committees are independent and different groups of people will have a different opinion on matters, but it is something that does continue to come through the user feedback process. And we ask each of our committees to undertake shared ethical debates as well, which is a quality assurance exercise where we pick different topics and invite committees to debate them. And it's where we sort of compare and contrast what kind of issues committees come up with, so we can identify what sort of training might be needed, and to help us with consistency and look at what any further guidance that we can provide for ethics committee members. So some of the topics we've selected are listed here. So for example, with the COVID-19 pandemic, we had a lot of applications coming through where consent was being obtained remotely from relatives by telephone or video conference, and a lot of committees were unsure about consent being taken in the remote setting. So we produce some scenarios for them to debate, and then publish some guidance for ethics committee members when reviewing those types of applications. And some of our more recent topics have been the inclusion of pregnant people in clinical trials. Artificial intelligence is one that comes through a lot as having ethical issues, so we've given that to the committees as a shared ethical debate. So it's a good way of us as an operational management team identifying what further guidance might be helpful for our committees. I did have 2 further slides, but I'm conscious of time, Gordon, so do we have time, or would you like me to stop and let the next presenter continue?
That's my fault, I was on mute. Charlotte, how about you summarising, like finish up with a couple of sentences about your thoughts of looking to the future, please.
Perfect, lovely. So looking to the future, as I've mentioned, we're in doing our best to ensure that the UK remains an attractive place to undertake health and social care research. So we've made a lot of improvements to the ethics service. We're now working with NHS hospitals to look at what we can do with help with the backlog, and whereas we're doing our ethics reviews quickly, there's a lot of delay in actually setting up the studies in the hospitals, which we need to address and make sure to ensure that we continue to get clinical trials in the UK, because it's dipped 41% in terms of the number of clinical trials we're getting since 2017. So we're doing a lot of work with the NHS hospitals at the moment to help them with study setup. REC member recruitment continues to be a challenge for us. So we want to make sure that we look at how we can offer more flexible ways of joining our ethics committees. Online ethics committee meetings, I've talked about the advantages and disadvantages of those, so it's something that we're continuing to support our ethics committee members with, and also addressing the feedback that we receive from REC members on the amount of time that it takes preparing for meetings and the volume of documents that they're needed to look at. And finally, I'll finish on just to set out 2 pillars, which is our HRA strategy, and the 2 pillars are include, to ensure that health and social care research is done with and for everyone, and to accelerate research findings, improving care faster, because the UK is the easiest place in the world to do research that people can trust. So our strategy over the next 3 years at the Health Research Authority is focused on include and accelerate. Thank you very much, Gordon. I hope that summarised it.
You know, Charlotte, like I'm sure Kylie's going to have a lot to say about this, and it's going to be very synergistic. But honestly, I think if we're looking to the future of HRECs in Australia, gosh, you have done so much work there, and I have so many questions, and I see Roberta has a question as well. Maybe we'll just have 2 quick questions, Kylie. I'm sorry to be a bit long. How did you manage to reduce the number of HRECs to 64, and what were the criteria for doing so?
It was just unmanageable. What was happening previously was that the same application was being submitted to lots of different recs. So by introducing one ethics opinion for the whole of UK, Wonderful. It meant that actually we could reduce the number of applications per meeting. Well,
it's just amazing you've done that. I'm just going to ask Roberta's question because it's there. Look, I have so many about guidelines, constitution, appointment, payment, researchers attending meeting, which I love, by the way. Data protection in your information review form, which I didn't see, but that's another thing we will talk offline. Final question: does the HREA charge a fee for commercial trials? If so, how much?
Well, it's an interesting one. We don't at the moment. Some of the commercial organisations have offered and said we will pay you if you do it faster. It's not something we've done. It's interesting because they submit to the MHRA, who do the safety review. They do pay for that review, not for the ethics review. And now we've combined the ethics with the safety review undertaken by the MHRA. It's not to say it's something that we won't be doing in the future, but no, we don't currently.
Yeah, that's really amazing. And by the way, 31 days for a full review. I think we would all be. I know we can do it faster, but I think for including clinical trials, that's impressive work, and I'm fairly sure we can learn a lot. Charlotte, gosh, you could go on for the next hour, but we won't bother. Really, thank you so much for taking the time especially knowing how early, well, it's early now, you can get up for breakfast now in the UK. So please join me in thanking Charlotte. That was amazing, Charlotte, and we will definitely be in touch. I really love that. That was wonderful. Thank you so much for your time.
Thank you.